I know some people are waiting. Hey, John, I think that's you. What's your question?
John, are you talking to John?
Yes.
Well, what I was showing is a nasal spray, and I've never been around anyone that has OD'd. So I'm wondering if their breathing is if they're not breathing, will that still save them?
Well, yeah, sure. So, John, that's really the point of the naloxone. If they're close to death, then the idea is that for it to reverse the overdose symptoms. That is, if they're not breathing, if they have pinpoint eyes, if their skin will, their skin will start to turn kind of a bluish, purplish tinge to it. So this drug is there to help revive those vital functions that we see in patients.
And I think the reason it's a nasal spray is because the mucous membranes are so close to and the blood vessels are so close to the surface in the nose. So the idea is that that's the administration site where it gets more quickly into the bloodstream. You don't breathe it in. It's how it's absorbed because it's through the nose. Fascinating.
Which makes sense.
Yes.
Perfect. All right. So Joey, is that you, Joey? Joey, are you there?
Yeah, Joey?
Yeah, what's your question?
Yeah, well, one thing I've noticed firsthand is the doctors are cutting people off directly, and they're going to the streets and getting who knows what with fentanyl in it, and that's a big problem. I don't cut the person directly off. I'm seeing it firsthand. They're just going out to the streets, and nothing, a misconception around trying to get high, but they're not just trying not to be sick, I'm saying firsthand,
And you talked about that earlier.
And I think that he's absolutely correct. They're just trying not to get sick, and they will get very sick coming off of when they're dependent on opioids. And nobody, sets out to be an addict. Nobody really wants this. But after you've been given that kind of a dosing regimen, it's very likely you're going to become dependent. So what we are trying to encourage is when doctors, remove a prescription from somebody's treatment regimen, that they refer people for assessment for treatment, because, again, just taking somebody off an opioid doesn't solve the problem. We need to make sure that they're assessed for addiction and given proper support.
And that's what we kind of notice, especially with like Suboxone, for instance. It's always paired up with counseling, and it's not just that one thing. It's they got to come in, and Vivitrol, same thing. I want to know from the city standpoint now, what is the latest effort to combat fentanyl, and is there anything new that you guys are doing or planning to do?
Well, I think when you get into the idea of combating illicit drugs, it really is a law enforcement issue at that point in time, and public health doesn't really have any inroads into cutting off shipments from China or wherever else. So the public health role is really helping monitor what's going on with all the different combinations of drugs. We are working with trying to set a trigger point, so if we notice unusual amounts of overdoses happening or unusual characteristics of overdoses, that we can get early notification and then coordinate with first responders and community stakeholders to really look at where do we target. Can we get Nashville Prevention Partnership to come with naloxone kits to a particular neighborhood if we notice that it's happening in a particular area. So we're really trying to get a lot clearer on where to point our resources.
And so it seems like it's kind of broad at this point.
It's broad, and I think we've started to narrow down in a lot of ways, but it's still going to require more and more work and gathering other pieces of data and bringing that together. And we do have some capacity within public health to really look at that and lots of different ways, and then get back to the community stakeholders with that information.
Do you have any information right now as far as where the problem is more prevalent?
Yeah, we have some information around certain zip codes, but within Davidson County at the moment, I think it's safe to say, sort of Madison area and Antioch area, we notice a lot more overdoses in general, not necessarily just deaths, but even non-fatal overdose activity. I don't have those numbers with me, but those areas certainly seem to have a lot of activity.
So how were you able to at least identify Madison? Is it just through the calls? Is it just through...
There are different data sources. So you've the fire EMS response information, where they're responding to hospital emergency departments have information on who's coming to the different hospitals, so you can see some of the activity through that also. And then just community stakeholders, who's on the ground, who's able to give you information also.
Wow. All right, so let's get back to the lines. Hey, Billy, thanks for calling. What's your question?
Yeah, I was just speaking to someone. Like I was telling them, I have a daughter that right now she's in a hospital because she overdosed, almost died. And myself, I'm in my 60s. My wife has bone marrow cancer, and I have some health issues where we're required. We need to take opioids to help control our pain. And for us, it's everybody's out trying to sue the pharmacies and all, and they make it hard on legitimate people to get their prescriptions. And the people on the street are still getting everything. And you had somebody call in a minute ago talking about taking, cutting people's codeine, and then they go out on the street and buy stuff with fentanyl in it, and it's just a bad situation.
Yeah. And I think we'll hear that time and time again.
Yeah.
It's like, obviously you gotta push forward with something like this, but it's almost a growing pain. I don't know if that's a safe description.
Yeah.
But we have a transition right now that we're trying to make into some other pain management strategies, and those are not the things that people are used to being prescribed by their doctor. So being able to go to an AccuDetox program, being able to go for massages or physical therapy is not typically what, it's just not what they're used to, and it takes a little bit more time and effort than taking a pill 3 times a day or something. Right. So it's a different conversation, and it's a different type of treatment regimen to follow.
And I think regardless of whatever the addiction is, fentanyl, opioid, whatever it is, there are services, recovery efforts. We'll talk more about that when we come after the break.